Welcome back to The Pulse. Let's now talk about an essential part of our life. It's health. Today is World Epidemiology Day, and for the first time, epidemiologists in Ghana are holding a month-long celebration with the hashtag World Epidemiology Day. The day is a global movement to recognize and raise awareness on the vital role of field epidemiologists in protecting the health of people and advancing global health security, and to advocate for increased investment in that field, training, research, and professionals. The past year has brought unprecedented visibility to the work of field epidemiologists as the world has fought COVID-19, but this visibility has not always resulted in understanding the importance of field epidemiology, nor in the increased support needed to strengthen public health systems around the globe to better detect and respond to outbreaks. Now, don't worry if any of these sounds technical to you. We're joined by experts to tell us why epidemiology should be important to you. And joining me to do that is Dr. Ameme Done, is epidemiologist, African Field Epidemiology Network Ghana. Dr. John Tenge is president of Field Epidemiologists Association of Ghana. Now, let me start with Dr. Tenge. The whole idea about this is to get the public to appreciate the importance of the work you do. I want you to share with us why epidemiology is important, starting from Dr. Tenge.
Thank you very much. Good afternoon to you and all your listeners. Epidemiology is basically the science of detecting diseases, determining disease determinants and the risk factors. Then after doing this, you gather your data, you interpret it, and then you compare and you make decisions. So basically, field epidemiology is the epidemiologists who basically work on the field to help with disease outbreak surveillance and even training of other disease surveillance officers to help combat diseases. And it's not only epidemic-prone diseases. Epidemiologists looks at any disease entity that has an effect on the human race. So basically, that's what we do as epidemiologists. Thank you.
How much of importance, should we attach to this epidemiology? When we talk about health, Dr. Done.
So could you kindly take that again?
Hello.
Can you take that again?
I'm just finding out, if you look at the hierarchy in our health system, how much of importance should we place on epidemiology?
Okay, so that's clear. So I think that answer is quite obvious. Looking at the situation in which we are, particularly with regards to COVID-19, everybody keeps mentioning the word epidemiologists. Some even go to the extent of mentioning some of the activities that epidemiologists are engaged in. But this kind of visibility we identify has not translated into the understanding of who the epidemiologists. We can all attest to the fact that epidemiologists are very, very important when it comes to health security, not only in Ghana, globally. So in terms of the scheme of things, I think epidemiologists are very important, not only to be in the health sector, but also their function cuts across the health sector to even business, because the current COVID-19 affects not only those in the health sector, but it affects everybody, including businesses. So we think that field epidemiologists are very, very important.
So especially as we are presented with COVID-19, I think there's no better time to discuss the key success stories of this field and also talk about challenges. What are some of the key success stories you can share in this field?
Okay, so, to look at the success stories, I think I'll first of all want to talk about the field epidemiology in Ghana. So, field epidemiology is Ghana's driven epidemiology and laboratory training program, which is a collaborative program between the Ghana Health Service, the Veterinary Services Department, the U.S. Center for Disease Control and Prevention. And then this collaboration trains field epidemiologists in on-the-job training and a competency-based training program. So this program has a majority of is in the field work. So over the years, we've trained over 170 frontline health workers in all the 3 tiers of field epidemiology training. That is the advanced training, the middle training that we call the intermediate training, and also the lowest training we call the frontline training. We are currently in the process of training all 3 tiers of field epidemiologists. With regard to COVID-19, before even COVID-19 was detected in Ghana, we have trained a lot of field epidemiologists in preparedness for any eventuality that may occur. We didn't know that we were going to be faced with COVID-19, but we knew for sure that there were going to be outbreaks. So we had this preparation ahead of time. We've also, when COVID-19 actually was detected in Ghana, we've been involved in training of health workers with regards to how to conduct contact tracing. We've also implemented contact tracing at the district level by supporting the districts, the region, and also at the national level. We've also been involved in taking samples from the field and testing them at the laboratory. Our products have also been involved in the laboratory work itself and management. So with regards to all the aspects of COVID-19, I think that field epidemiologists have been involved. And this I've described is not only pertaining to Ghana, but it cuts across the whole world.
Dr. Tenge, I saw that you were nodding when Dr. Done was saying, definitely there are also challenges. For you, what have been the success story? What have been the challenges? Where do we strike a balance?
Okay, so to add to what Dr. Done said, right from day one of our COVID, we were called upon to actually go into the community where there was evidence of community transmission. It was most of the field epidemiologists who were sent to the epicenters, the districts, to be as field epidemiologists to help with the district directors and the disease control officers. So we were leading the effort during the lockdown, gathering data, collecting all the GPS mapping for the government to make decisions whether indeed even the lockdown has to be extended or not. So we have been involved in this field for a long time, and so COVID came that, as Dr. Donner said, our relevance has really been now on the lips of many Ghanaians talking about field epidemiologists or epidemiologists. And not only this, we have also been involved with most outbreak investigations in Ghana. Over 100 outbreak investigations, our members have been part of it in the field, in the districts, regional levels, and even international levels. Some of us have been called even to assist in other regions, like even like the Ebola outbreak in Sierra Leone. Some of our members were sent over to assist with them. But the challenges that we face is the government has been helping us so much. Yes, with support, with members from the Ghana Health Service, giving them the support to come for the training and going back. But the other challenge that we have is placement. When we complete school, some of them go back and still go to do the same old things. So the major problem with the alumni or the members when they come back is placement. Even though most of our members have been placed working with programs, with the health institutions and other programs, but we're still saying that some of the members, when they come out, placement becomes an issue. So that's one of our major challenges that we are facing with it. And also when it comes to funding, to do most of our research, we have a lot of research proposals that we are writing and then doing the training. So these are some of the places that we really want to do more to help with our health sectors in Ghana. But the funding should be more and more attention to be placed on the field epidemiologists.
Okay, so I'm happy you talked about funding because I think there's a gap that we all have come to learn about. How do you think that we can cross this bridge, Dr. Done?
I think that just to mention that with regards to the challenges that Dr. Tenge has mentioned, these are challenges that are mirroring the reasons for celebration of World Food Epidemiology Day. So the call to action is for the world to be able to know the role that field epidemiologists play in protecting the lives of populations globally. And that also pertains to Ghana. We are also calling for investment, increased investment in the training of field epidemiologists, recognizing that they are very important as far as our health sector is concerned, and also for the economy at large. So we want investment in the training of field epidemiologists. We are also calling for investment in research, because field epidemiologists only solve problems. We only go to the field to go and solve problems. But to be able to solve these problems, we need the research to be able to get the evidence from the research to solve the problems. So we also call for investment in research. We are also calling for investment in the field epidemiology professionals also. We want investment in the professionals, like just as has been mentioned earlier on, investment in when the field epidemiologists are trained, how are they placed to be able to function effectively? Do they have the tools to be able to work with? We want investment in the surveillance architecture to accommodate field epidemiologists wherever they are. So these steps that I've mentioned are the reasons that cut across all field epidemiology training programs globally, and for which reason the World Food Epidemiology Day is being celebrated.
Dr. Tenge, you want to add on to the list of things that Dr. Done has said?
Yes, basically, we also need support from Ghana Health Service, especially when you go to the district directors and other stakeholders, because sometimes after your training, when you go back, they still want to put you where you were before you went. And then some funny thing, somebody went back and somebody asked him, what were you doing before you went for this program? And I've been doing this for this many years, so you can't go and do this program, come and lord it over me. So it's not a matter of competition, it's a matter of backing ourselves to help with the health system. So
it's teamwork.
We want to plead with people that we work with and other stakeholders to just accept us as we have been trained to do field work as epidemiologists, and not that we are going to take over their work or anything.
But of course, I'm happy you talked about funding. And I know that government has committed some funding into epidemic preparedness and response, especially now that we have COVID-19 and the others. How significant has this been over the years? Dr. Done, you can handle that for me.
So, so that's, I can say that government has supported in field epidemiology training, as we have alluded to earlier, because field epidemiologists that are trained in Ghana are mostly people who are already in service. So they are either in the Ghana Health Service or Veterinary Services or Food and Drugs Authority or the Environmental Health Services. We try to use the approach of One Health. So all of them are already in services, and they are released to be trained in the program whilst they are getting their full benefits, the full benefits of their salary. So they are all on steady leave pay. That is quite a huge contribution. So there's what is actually lacking that we think can be done is if there is a dedicated budget line for field epidemiology training, because we have all agreed that building capacity for outbreaks is the first step. Some of the outbreaks we can prevent, but outbreaks are will always occur. They are inevitable, and for which reason we need to be prepared before they occur. So the training is a very important component that we think that if there's a dedicated budget line for field epidemiology training, that can suffice. But this problem is not really peculiar to Ghana. It happens all over the world, and in recent times, even the CDC, the US CDC, and the global body for field epidemiology training has appealed to US Congress to increase funding for field epidemiology. So it's not a situation that is peculiar to Ghana. There is something that is being done, but a lot can be done.
So what's your take, and this one I want Dr. Tenge to handle this for me, on the National Action Plan on Health Security and government's commitment to funding its implementation?
I think with the National Action Plan for Health Security, I think Ghana government have done a lot on that, and that it has really gone far, and then they are really committed in seeing it coming to pass and committed to it being implemented. I mean, part of it has been implemented, and even recently they did an evaluation of the ones that are already being implemented. And they also saw some gaps in it, and it goes back to the funding issue. But if we are all committed to it and then support government with this effort to say this implementation of this action plan for health security, it's going to be a very good thing for us because it encompasses everything, including outbreak investigations. We all know how this COVID has hit us so much, and then almost every country that COVID has been in has affected their economy. So it's very important to look at this action plan, because when it's really implemented to its fullest, it's really going to help us so that we prepare all aspects of our health system, whether it be preventive or curative, and all ever ready to fight other outbreak investigations.
Would you advocate for an annual national budget line for, epidemic preparedness and response, or maybe a national public health emergency fund, Dr. Done?
Well, okay, so I think that we can look at it this way. We have to look at the pros and cons of these two approaches that you've described. For an emergency fund, we have to look at how are we going to activate this funding. Are we going to restrict this funding to only when an emergency occurs? But from the discussions that we've had so far, we realize that emergency preparedness and response starts actually from preparedness. So if there's going to be a fund that we can only activate when there is an emergency, then it means that we may be shooting ourselves in the foot. On the other hand, if you look at the dedicated budget lines, that may suffice. For example, if outbreaks don't occur, we can be able to use funding to be able to train and prepare for the outbreak to occur. So these are the ways we look at it. You can also look at the funding, the creation of the fund in terms of the fact that it will be able to engage a lot more people in terms of getting resources pulled into the funding. So to me, if I should take a stand, I would think that we have to take a hybrid of both the fund and also creating budget lines, so that the budget lines can be used as and when we want to prepare and also respond. And then the funding, we get mechanisms in place to be able to activate them and use them for emergency response.
Of course, as a country, there's the need that we prepare for such epidemics, and then also for response. What would you recommend as steps government should take to actually prepare in terms of outbreaks when they occur?
Okay, so we've mentioned some already. Government is already doing a lot. We are training field epidemiologists, which is one of the key aspects. We are also providing the tools that the field epidemiologists need at the various levels. We have trained at national, regional, and the lower levels. There's also the need for us to, for us, I think this question is not only about government, it's about what can we all do. Yeah. Because in terms of responding to field public health emergencies, this transcends beyond only the confines of what government can do. What can you do? What can I do? What can the public do? We need to also call on corporate Ghana. Corporate Ghana should be able to realize the importance of field epidemiologists, so that we do not only overburden the traditional sources of funding of field epidemiologists, but we move beyond these traditional sources, get into corporate Ghana, because when epidemics occur, it can affect businesses as well. So everybody should recognize, the general public should recognize that when they are able to follow protocols that have been put in place, then we are able to curtail or stop or control emergencies. And all this will be able to help us as a nation to be able to control or effectively respond to public health emergencies. So I think the call to action is for all of us, general public, journalists, the medics, and also government as well.
On this day, as we celebrate World Epidemiology, do you have a specific request on this day, Dr. Tenge?
Well, for this day, we really want the media to help us to really make awareness, create awareness of the things that we do as field epidemiologists. So we'll be coming to the media to have such interviews like this, and some of the programs that we have lined up for this month is actually taking place from now till the end of September, like radio interviews, like health screening. So we need this support. I know the media is doing a lot when it comes to this pandemic period about the protocols and all that. So we need the maximum support for our program this month, so that we all can be hands on deck, so that we go over this pandemic, and then all of us will have our lives back.
I want to thank you this afternoon, Dr. Meme Done, epidemiologist, African Field Epidemiology Network Ghana. Dr. John Tenge is president of Field Epidemiologists Association of Ghana. I'm grateful, gentlemen, for joining the conversation.